Okay, today we're going to talk about homeostasis. The learning objectives for this module was to describe the mechanism that maintain homeostasis in the body and how these mechanisms adapt with aging, stress, exercise, injury, and disease. And this is actually a really big process. So I'm going to try and hit the highlights here. We could probably spend the rest of the year talking about this particular subject. We go over some definitions. Homeostasis is the tendency to resist change in order to maintain stability. Your body likes to work in a very narrow range, and you'll hear me talk about this several times during this lesson, and hopefully, like I said, this is a review for you. But in order to maintain that range, this is normally that is done through either a negative or a positive feedback loop. The negative feedback loop being far more common than a positive feedback loop. Got a short YouTube video that's going to quickly go over this that might help explain it better than me.
So what is homeostasis? Homeostasis is a term first defined by Claude Bernard in 1865. It means maintaining a constant internal environment. Wow, great. That really explains it, doesn't it? Let me try and make it a bit clearer then. Imagine the cockpit of a plane. It is packed full of dials and it is the pilot's job to make sure they all stay in the right place. If any of them change, he will correct the plane to keep them in the right place and the plane in the air. This is a bit like how our brain works. Sensors all around the body measuring various things and sending the information back to the brain. The brain then does its best to keep all these things stable and constant to keep the body working properly. So what kind of things need to be kept constant in the body? Well, it's very important to keep our temperature the same at around 37 degrees Celsius. You can find out more about this in the video on temperature regulation. You also need to keep the levels of sugar in the blood constant along with levels of ions and water. Your blood pressure needs to be carefully monitored along with the amounts of waste in the blood, such as carbon dioxide and urea. Okay, so let's say one of these factors goes too high or low. What is the brain going to do to get it back to the normal levels? The answer to that is negative feedback. Negative feedback is the process where the brain uses either a hormone or a nervous system to send a signal to the part of the body that can rectify the problem. For example, after you eat a meal, your blood sugar level increases. You can see it on this graph. This is detected and the pancreas will release a hormone called insulin that causes... Therefore, as you can see on the graph, the blood sugar level returns to normal. Negative feedback is the loop from which the body detects the stimulus, reacts by responding accordingly, and brings the body back to the normal levels. So why is homeostasis so important? Our metabolism, which is all the chemical reactions in our bodies that keep us alive, is controlled by enzymes. These enzymes only work in very specific conditions. If these conditions change, they could stop working and we could die. Luckily, all this happens without you having to think about it. If you had to do it yourself, you would spend all day and night just trying to keep all these things constant and would have no time.
All right, so hopefully that helped a little bit. That's basically what we're going to cover today. So the first thing that we're going to talk about is temperature, and he mentioned that in there. This is a very good way to describe the negative feedback system. So, and this is controlled by the hypothalamus. We either sweat or we cause vasoconstriction, vasodilation, and sweat, or vasoconstriction and we shiver and to maintain our temperature. This is kind of a little graph to the negative feedback system here. But you know, everything is not as simple as that. There are lots of things that impact temperature, particularly convection, radiation, evaporation, and conduction. Convection is just like wind. If you stand out in a windy day, even if it's warm, you feel cooler, right? And so radiation is when you radiate heat to a nearby surface. Evaporation is the process of basically air evaporating off your skin that makes you feel cooler. That's why we sweat, so it evaporates, we feel cooler. And we also lose a lot of fluid and evaporation that can cause issues with breathing. Our breath is actually very moist, as you know if you've ever tried to use your breath to clean a window or that sort of thing, or glasses or whatever, sunglasses. And so you actually can lose a significant amount of fluid just from breathing. And then conduction, and that's where actually touching something. If you lay on a cool floor, you feel much cooler because you're losing heat through that conduction. Now, at different ages, this affects people differently. For the very young and for the very old, there is a major problem with that. The young, very young infants have a large body surface area compared to their mass, so they are more prone to heat loss. And then, of course, the younger the infant, the less fat or brown fat they have, which is actually a different sort of fat than you have as an adult. The more problems you'll have with heat loss. And then the same for elderly people. They cannot regulate their temperatures as well. People over 65 are at much greater risk for heat stroke or exhaustion. So you need to think about that with your patients that are older, especially if they're exercising or doing anything in the heat. They also don't retain, they can't produce heat as well either. So on both ways, and it's the same for both areas. Young babies will, theirs is more of a problem with heat loss normally than being overheated, although that can happen. They actually are usually too cool because of the lack of body fat and surface area and that sort of thing. And then the elderly really have it bad both ways. They don't cool down well and they don't heat up well. So think about that when you're talking about your elderly patients. So this is an example of a positive feedback loop. And this was platelet formation, or excuse me, clot formation. And so you'll kind of see that positive loop feedbacks are less common in our biology than negative feedback loops. And there can be some issues with positive feedback loops. They can kind of go a little out of control, or they have a potential to do that. So here was another example of a positive feedback loop, and this is just labor, the cervical tissues tension, the contraction, stretch receptors are stimulated, the hypothalamus produces oxytocin that influences smooth muscle on the uterus. The cervix is stretched, causes more stretch, so you get this positive feedback loop. Of course, here we are going to have an end result. You're going to have a birth of a baby at some point, so you're going to cut this the stretch part out of this particular feedback system. Another positive feedback system is the release of oxytocin and prolactin with breastfeeding. The breast is stimulated, releases those. Milk is let down, the baby sucks, that sort of thing, until the baby quits sucking. All right, and we talked about narrow ranges, and we really do stay pretty much in the narrow range. I think I had the Celsius temperature before, but this is just the Fahrenheit temperature for our body temperature range. Then glucose range is around 70 to 100. But this is different for very young children. Their glucose than like brand new infants. Their glucose can be lower in the 50s, 60s, and actually even the first couple of days in life in the 40s and be normal. So that's a difference. And then as you age, and we're going to talk about this in a minute, as you age, your glucose levels tend to rise, even in non-diabetics. pH level 735 to 745. Sodium level 135 to 145. potassium 3.5 to 4.5. And so that makes it very convenient. So if you can just remember the context of what you're talking about, if you just remember 3.35, and 45, you're way ahead of the game. Also, bicarb. Now, bicarb, HCO3, I have here 18 to 22. You can see 20 to 30. This really is more lab dependent, so you just got to know what's normal in the lab where you're getting your lab work from. So the first thing we're going to talk about is glucose, and we really want to stay in these kind of levels. We know if your brain only runs on glucose, so the glucose levels fall significantly, you can get into big trouble as far as brain function goes, which can be kind of a big deal. And then if it's too high, of course, low is more of an immediate effect. We're more worried, at least in the short run, probably in the long run too, but you don't have to worry about hypoglycemia in the long run because you're going to die. But we're more worried about that in the short run. But the long run, hyperglycemia, which is what you get with diabetes that's untreated or incorrectly treated, can cause a lot of damage in the long run. So, so we really want to keep glucose control as much as possible, and your body really tries to do that as well. Here's just a schematic of the negative feedback system for trying to maintain normal glucose. Okay, and you can look at these slides and look at this over at your leisure. As we said, glucose control as you age you tend to have a higher glucose even in non-diabetics. Of course, we know that type 2 diabetes is the older you get, the more chance you have of developing that, just because you've lived longer and you've caused more abuse type thing. But even if you don't have diabetes, they do tend to rise. The next thing we're going to talk about is blood pressure. Once again, blood pressure likes to live in a narrow range. Too low and you have syncope, and a variety of other problems. If you have low blood pressure, you can get into trouble faster. I'm just thinking about this. Really, low blood pressure is more of an immediate issue, depending on how low we're talking about. But if you truly are hypotensive, you can get into pretty big trouble with that, and that's something we're not going to leave. And you pretty much want to find the underlying cause of the hypotension. Usually it's going to be blood loss or sepsis or medications, that sort of thing. But whatever the cause is, you want to treat that. And then hypertension will cause issues in the long term, and with micro tears in different organs, and they can cause long-term damage. Anyways, high blood pressure is when the blood pressure is too high. We have baroreceptors that fire, and they trigger the parasympathetic system in the heart, causing a decrease in cardiac output, so that we're causing less pressure, and we're also going to cause vasodilation. We're going to do things that are going to try and bring down the blood pressure. So if you think about blood pressure, which is, I just talked about low, but this is high, the more vascular resistance you have, the higher the pressure is going to be, right? So if you have a lot of vasoconstriction, your heart has to pump harder against that, so the blood pressure is going to go up. So one of the ways that your body can compensate for that is vasodilation. You're going to start losing urine through your kidney is going to filter off more fluid. You're going to decrease your cardiac output just to stop the pressure there. So it's going to try to have some mechanisms to decrease your blood pressure. So if you think about a situation on a normal person, not a hypertensive person per se, where you're very much exercising and that sort of thing. So you're getting hot, which is one of the deals. You're increasing your body temperature, but you're also increasing your blood pressure. So the vasodilation that occurs during exercise kind of helps both areas. You're kind of dissipating some of that heat, and you're also decreasing some of the resistance. There. Low blood pressure is kind of the opposite sort of situation. You are going to trigger the sympathetic nervous system and cause vasoconstriction, kind of the opposite of what we just talked about. So, and this is going to be more of a problem, like I said, with usually secondary cause, bleeding, trauma, that sort of thing. Okay, this next slide is just talking about cardiac output and stroke volume.